We are going to discuss the physical therapy management of the frozen shoulder. First of all, physical therapists educate the patient about the condition, that the condition of frozen shoulder take time to resolve, and also educate the patient and encourage the patient to be compliant with the treatment to have better outcomes. When someone with frozen shoulder came to the clinic or hospital, first of all, we manage the pain of the patient, which we can done by using heat, ice pack, or by using TENS. Then we focus on regaining the range of motion or strengthening the shoulder muscles, which we can done by using stretching and strengthening exercises. Here are the different exercises which one can done if he or she is having the frozen shoulder. We discuss them by one. First of all, this is a picture of active assisted exercise for shoulder flexion. For this, we instruct the patient to place a band in both hands and take both hands above the shoulder level as much as patient can and hold there for a few seconds or as tolerated by the patient. Next, it is a picture of active assisted exercise for external rotation of the shoulder. For this, we instruct the patient to be in the sitting position and place a band in both hands and slowly take the symptomatic shoulder hands away from the body, or we can say the side of the body. And patient is instructed to be gentle when performing this, because if patient can vigorously do this, this can aggravate the pain of the patient. Next, this is the pendulum exercise. For this, we instruct the patient to lean over and place the asymptomatic hand on the table or chair, hang the affected arm down, and slowly swing the arm in the small circle for up to 10 times, which ultimately increase the flexion and abduction on the shoulder joint. Next, there is exercise for the internal rotation. For this, patient is in the standing position and patient is instructed to take the affected shoulder hand behind the lower back while using the other hand and take it to the mid of the back. And when patient is capable to independently take his or her hand to his or her back, then we progress this exercise to the towel stretch. For this, the towel is of 3 feet length and patient is standing straight and patient is instructed to hold one end of towel with one hand and then bring the towel behind the back, and by using the affected shoulder hand grasp the other end of the towel, and then patient is instructed to pull the one end of the towel in the upward direction and the other end of the towel in the downward direction, and do this exercise for 10 to 20 times daily. Next, there is close body stretch, which is for the posterior capsular stretch of the shoulder joint. Patient is in the standing and sitting position, and patient is instructed to gently pull your arm of the affected shoulder across your body and stabilize it with your other hand, and keep this stretch for a few seconds or as patient is tolerated, and then progress it to 30 seconds. Next, there is shoulder abduction exercise. For this, patient is instructed to stand straight and take the forearms away from your body and keep your elbows straight and thumbs are pointing in the upward direction. And then raise your arms over your head as far as you can without having pain in the shoulder joint, and hold this position for as long as you can. Next, the finger walk exercise, which is also for increasing in the range of motion of the shoulder abduction. For this, patient is standing in front of the wall by keeping an arm length distance from the wall. By using your affected side arm, slowly reach out and touch the wall with your fingers by keeping your arms slightly bent. And then patient is instructed to slowly walk your fingers up on the wall and move forward as far as you can comfortably, and then walk your fingers back down to the wall to the starting position and repeat it 10 to 20 times. Then there is strengthening exercise for the scapular muscle. For this, the patient is in the standing or the sitting position. The patient is instructed to take his or her elbows at the side and bend the elbow to the 90-degree, and then move your shoulder blades together and then return to the starting position. Then again move the shoulder blades together and repeat it 8 to 12 times. Then there is corner stretch exercise, which is particularly to stretch the chest muscle and particularly pec major muscle. For this, patient stand near the corner of the wall with the hand stretched out on both sides. Patient is instructed to lean your body in, which can open the chest muscle and hold it for 10 to 15 seconds, and then return to the starting position, and then lean your body in and open up your chest muscle, and do this 10 to 12 times daily. Next is the mobilization of the shoulder joint. The mobilization of grade 1 and 4 is particularly used to manage the pain of the patient, while the 2 and 3 grades are used to increase the range of motion on the shoulder joint. Here, the physical therapist is performing the interior mobilization of the shoulder joint, which can increase the extension and external rotation. While here, the physical therapist is performing the posterior mobilization of the humeral head, which can ultimately result in increase in flexion and internal rotation on the shoulder joint. When a patient is capable to do each and exercise which we discussed previously effectively, then the patient is instructed to do them by using band or by using resistive bands or pre-weights in all the movements of the shoulder joint. It can ultimately result in maximizing the strength of the shoulder muscle. Thank you.